Diabetic retinopathy. Diabetic retinopathy, bite the dust up bet ik ret ihnopau, is a diabetes confusion that influences eyes. It's brought about by harm to the veins of the light touchy tissue at the rear of the eye, retina. From the outset, diabetic retinopathy may cause no manifestations or just gentle vision issues. In the long run, it can cause visual deficiency. The condition can create in any individual who has type 1 or type 2 diabetes. The more you have diabetes and the less controlled your glucose is, the more probable you are to foster this eye intricacy. Indications. You probably won't have indications in the beginning phases of diabetic retinopathy. As the condition advances, diabetic retinopathy side effects may include spots or dim strings drifting in your vision, floaters, obscured vision, fluctuating vision, hindered shading vision, dim or void regions in your vision, vision misfortune. Diabetic retinopathy as a rule influences the two eyes. When to see a specialist. Cautious administration of your diabetes is the most ideal approach to forestall vision misfortune. On the off chance that you have diabetes, see your eye specialist for a yearly eye test with enlargement, regardless of whether your vision appears all good. Pregnancy may demolish diabetic retinopathy, so in case you're pregnant, your eye specialist may suggest extra eye tests all through your pregnancy. Contact your eye specialist immediately if your vision changes unexpectedly or gets foggy, inconsistent or murky. Causes. Over the long haul, an excessive amount of sugar in your blood can prompt the blockage of the minuscule veins that sustain the retina, removing its blood supply. Subsequently, the eye endeavors to develop fresh blood vessels. Yet, these fresh blood vessels don't grow as expected and can spill without any problem. There are two kinds of diabetic retinopathy. Early diabetic retinopathy. In this more normal structure, called non-proliferative diabetic retinopathy, NPDR, fresh blood vessels aren't developing, multiplying. At the point when you have NPDR, the dividers of the veins in your retina debilitate. Minuscule lumps, microaneurysms, jut from the vessel dividers of the more modest vessels, now and again releasing liquid and blood into the retina. Bigger retinal vessels can start to enlarge and get unpredictable in width, too. NPDR can advance from gentle to extreme, as more veins become hindered. Nerve filaments in the retina may start to grow. In some cases the focal piece of the retina, macula, starts to expand, macular edema, a condition that requires treatment. Progressed diabetic retinopathy. Diabetic retinopathy can advance to this more serious sort, known as proliferative diabetic retinopathy. In this sort, harmed veins close off, causing the development of new, strange veins in the retina, and can spill into the reasonable, jam-like substance that fills the focal point of your eye, glassy. Ultimately, scar tissue invigorated by the development of fresh blood vessels may make the retina confined from the rear of your eye. On the off chance that the fresh blood vessels meddle with the typical progression of liquid out of the eye, pressing factor may develop in the eyeball. This can harm the nerve that conveys pictures from your eye to your cerebrum, optic nerve, bringing about glaucoma. Risk factors. Any individual who has diabetes can foster diabetic retinopathy. Hazard of fostering the eye condition can increment because of span of diabetes. The more you have diabetes, the more noteworthy your danger of creating diabetic retinopathy. Helpless control of your glucose level. Hypertension. Elevated cholesterol. Pregnancy. Tobacco use. Being African American, Hispanic or Native American. Confusions. Diabetic retinopathy includes the unusual development of veins in the retina. Confusions can prompt genuine vision issues. Glassy drain. The fresh blood vessels may seep into the reasonable, jam-like substance that fills the focal point of your eye. On the off chance that the measure of draining is little, you may see a couple of dim spots, floaters. In more serious cases, blood can fill the glassy depression and totally block your vision. Glassy discharge without help from anyone else for the most part doesn't cause lasting vision misfortune. The blood regularly clears from the eye inside half a month or months. Except if your retina is harmed, your vision may get back to its past lucidity. Retinal separation. The unusual veins related with diabetic retinopathy animate the development of scar tissue, which can pull the retina away from the rear of the eye. This may cause spots gliding in your vision, glimmers of light or serious vision misfortune. Glaucoma. Fresh blood vessels may fill in the forward portion of your eye and meddle with the ordinary progression of liquid out of the eye, making pressure in the eye develop, glaucoma. This pressing factor can harm the nerve that conveys pictures from your eye to your cerebrum, optic nerve. Visual deficiency. In the long run, diabetic retinopathy, glaucoma or both can prompt total vision misfortune. Anticipation. You can't generally forestall diabetic retinopathy. In any case, customary eye tests, great control of your glucose and circulatory strain, and early mediation for vision issues can help forestall extreme vision misfortune. In the event that you have diabetes, decrease your danger of getting diabetic retinopathy by doing the accompanying. Deal with your diabetes. Make smart dieting an actual work part of your day-by-day schedule. Attempt to get at any rate 150 minutes of moderate vigorous movement, like strolling, every week. Take oral diabetes prescriptions or insulin as coordinated. Screen your glucose level. You may have to check and record your glucose level a few times each day. More incessant estimations might be required on the off chance that you're sick or under pressure. Ask your PCP how frequently you need to test your glucose. Get some information about a glycosylated hemoglobin test. The glycosylated hemoglobin test, or hemoglobin A1C test, mirrors your normal glucose level for the multi-month time frame before the test. For the vast majority, the A1C objective is to be under 7%. Monitor your circulatory strain and cholesterol. Eating quality food sources, practicing routinely and losing abundance weight can help. Some of the time drug is required, as well. On the off chance that you smoke or utilize different kinds of tobacco, request that your PCP help you quit. Smoking builds your danger of different diabetes inconveniences, including diabetic retinopathy. Focus on vision changes. Contact your eye specialist immediately on the off chance that you experience abrupt vision changes or your vision gets foggy, inconsistent or dim. Keep in mind, diabetes doesn't really prompt vision misfortune. Playing a functioning part in diabetes, the executives can go far toward forestalling intricacies.